Hi, welcome back to Straight Talk. Probably the biggest issue we all have, I don't care how much money you make, where you live, is your health and healthcare coverage. And how do we take care of people, especially if they're sick or they're addicted, or they have other problems that it just doesn't fit into a little box. We've got an organization in Baltimore. I'm going to find out how long. They have to have been around for over 50 years. I mean, or longer. Chase Brexton is just amazing. They've done incredible work for so many years with special populations. They were in the forefront of dealing with HIV/AIDS years ago. Terrific stuff. And we're really happy and excited to have Leah Hart, who is the medical director of population health at Chase Brexton Healthcare. So, Leah, I'm so glad you're on the show. I got so many questions.
Thanks so much. Glad to be here.
That's great. Well, for those that may not know about Chase Brexton, maybe a few, but give them an idea, an overview of kind of what you guys do.
Absolutely. Yeah, thanks for mentioning the history. Chase Brexton Healthcare is indeed a Baltimore institution. It was founded in 1978 specifically as a volunteer-run clinic, providing at that time specifically sexually transmitted infection testing, mostly for gay men, and was a safe haven for the LGBT community. So then when the 1980s brought the devastation of the HIV pandemic, Chase Brexton sort of by necessity became experts in HIV care, which at the time meant psychological and emotional support, given very few medical treatment options. And as treatment options for HIV expanded, so did the focus of the clinic. And eventually in 1999, Chase Brexton was the first historically LGBT serving clinic to become what's now a federally qualified health center, one of 6 in Baltimore City, one of 21 FQHC centers in Maryland. And now for those who are familiar with that history about Chase Brexton, you may be surprised to learn that we do see all ages now, kids, grandparents, pregnant people, the whole gambit. So we still do, have a special place in our hearts for the LGBTQ population. We have a health equity center led by Sam McClure and a gender joy program led by Elise Pine and Deb Dunn, and a brand new equity, diversity, and inclusion center of excellence led by Aya Schumann that we're very proud of.
Well, again, like you said, you've been around for a long time, and now it seems like you've blossomed into other areas to help the community, and that's terrific. And you should be certified by the Fed, because I hope they give you a lot of money. You certainly deserve it. And the way you've grown, you're a medical director. You look at things, from a medical perspective of what's going on in Baltimore. Is there any way to kind of sum up what are you seeing? Like you said, at the beginning, you were dealing with gay men, you were dealing with HIV, hepatitis. I mean, we've gone through. What are you seeing in our city that needs attention?
Absolutely. Thanks for that question. Baltimore is one of many places where you can sort of see through health inequities and health disparities, unfortunately, the outcome of what happens when systems over time are chronically and systematically causing a disinvestment in particular members of our community. So, housing redlining, transportation that's only accessible to some, education that's higher quality for certain groups. And of course, now we see, as a result of that, health inequities such as our Black citizens of Baltimore being 84% more likely to be diabetic, or Black women who are pregnant being 2.5 times more likely to die as a result of their pregnancy in Baltimore City, and in Maryland writ large, along with infants who are 2.5 times more likely to die compared to their white non-Hispanic counterparts. So these and other tragic, stark differences are the result of the social determinants of health and the situation that has been generation upon generation passed along and systematically advantaged some and disadvantaged others.
Yeah, that's a really good point, and something. I mean, Baltimore has been called the melting pot because we do have so many different communities, different ethnicities in our city, and everyone needs some kind of help through all this. And we also have a very large addiction issue. What's Chase Brexton doing or what are you seeing with the addiction? I mean, a lot of overdoses from fentanyl. We know that's going on. But when it comes
Absolutely.
to, I mean, when it comes to HIV, when it comes to Hep C, how are we dealing with that?
Yeah. And as overwhelming and impactful as the COVID pandemic has been, of course, in terms of health outcomes, opioid use disorders have continued to unfortunately take more Baltimoreans and Marylanders' lives over the course of the pandemic than COVID itself. So we should remember that that is a very current and chronic issue for our citizens. Chase Brexton does have a substance use department, and we so have therapy, counseling, and very importantly now, the medication-assisted treatment model that we know is critical to helping people maintain recovery. So we, as providers at Chase Brexton, are all required to have the ability to provide Suboxone to our patients, buprenorphine, and we're proud of that. So we make that part of our primary care. It's just part of what we do.
Yeah, that's terrific. I mean, everyone's wanting to expand, whether it's medical assisted treatment or whether something to be able to help people and break that cycle, which we're not doing. We need more, obviously need more help out there for people. Also, I find it's fascinating that hepatitis C, which is very common with addicts who are sharing needles, as well as people getting blood transfusions many years ago. And we have a cure. That's fascinating. It's so amazing to sit there and say, we've cured a disease in this country, but people need to talk to their doctor, get tested, something to be able to get the new medicine.
Yes, we do have within our population health department an effort to make sure that everyone who is eligible for screening, just based on sort of their birth date, having been alive during a time when there wasn't a treatment. And so healthcare related infections could occur. And now we have something we can do about it. So we really need to test everyone. We're systematically, we hope, catching everybody who we can to make sure that those who need treatment get access to it. And it's one of the greatest pleasures I have is continuing to have a panel of patients myself as a family nurse practitioner at Chase Brexton to be able to offer that service. And it's thanks in part to a partnership with the Sharing the Cure program that Johns Hopkins runs. It's a grant-based program to make sure that primary care providers can make sure that hepatitis C treatment is accessible, again, as just part of their practice under one roof. That's partly how the federally qualified health center model works. We are held to certain standards because we do get those federal dollars and subsidies that help us maintain services for the underserved and specifically uninsured patients, make sure that we can afford to do that with some federal subsidies. And so because of that, we're held to a pretty high standard of quality of care and also a model that offers many services under one roof. So not just medicine appointments, we have an OBGYN department, we have dental, we have mental health services, and pharmacy and laboratory, et cetera, all in one place so that people don't have to go various places and they don't have to go see a hepatologist or a hepatitis C specialist or a separate HIV specialist. We at Chase Brexton maintain our American Academy of HIV Medicine certifications and are doing full scope primary care plus these subspecialties as they come up.
Wow, you got a big job. The fact that you can smile means that you love what you do.
Absolutely. We do. It's a privilege to serve the community.
One last thing on the hepatitis.
Yeah.
Anyone watching, we're not just talking about those that are or have been using needles. We're talking about those that got a blood transfusion. I think it was around 1974, somewhere in that area. If you got a blood transfusion before that, it wasn't checked for hepatitis.
Yeah. Mm-hmm. For one thing, there was no reason to because we couldn't do anything about it, as a healthcare system. But now that there's treatment, we certainly can.
So anybody that did get a blood transfusion back then should definitely get checked again by your doctor now that we have a kind of a painless cure.
Yes, thank you for that plug.
Yeah, it's just amazing. I love the, we always talk about, especially with COVID, the response of government and this and the health departments and all this. Well, they cured a disease that killed thousands of people a year. It's fascinating. And,
It's
and
true.
hopefully we'll find more as time goes on.
Yes.
Where are you located?
We have multiple locations at this
Okay.
point. So downtown Baltimore, Mount Vernon, 1111 North Charles Street is our flagship center, and very accessible by several bus routes, which is helpful for patients. And then we have some county sites. So in Randallstown, in Glen Burnie, in Columbia, and we also serve Easton on the Eastern Shore.
Wow.
Yeah.
That's
And
pretty
in
cool.
addition to that, a student health center at the Maryland Institute College of Arts, MICA. A family nurse practitioner serves the students there as well.
Wow. That's wonderful. We only got 1 minute left. And I just, again, want to just thank you so much for all that you do. And I'm assuming COVID was a little tough for you too.
It was sure a test of all of our healthcare systems. We responded, and again, there were some federal subsidy dollars that allowed us to do this, but we became a testing center, we became a vaccination center, and my colleagues and I were really grateful to be in the position, having a primary care relationship with our patients to be able to advise on whether or not the vaccine was, safe and effective, which it is. And if you haven't gotten your booster yet, please schedule yourself for one at chasebrexton.org. So yeah, we were grateful to be, gainfully employed and part of the response and doing what we could.
And you did it. And again, you're out in the front lines and just doing the real work, the real difficult work. And I just hope that we can get the help for people who really need it, to get them off the streets, because really I believe that the crime issue has to do with helping people with medical problems and psychological problems if we're going to break that cycle of crime and violence, addiction, all that stuff. And what Chase Brexton does is just phenomenal. And like you said, you're an institution in the city. You should get all the money you need to do your job. And I want to thank you so much.
Thank you
for being on the show and really giving us a good perspective on what you really do out there and how much work. So be well, stay
Thank
well.
you. Appreciate the opportunity. Thanks.
It's our pleasure. Thank you. Today on Straight Talk, we're learning about financial issues. We're learning about health issues. And it's so great to know that Baltimore and the Baltimore region has amazing programs. And all you have to do is get in touch with them. So I want to thank my guests. Thank you for watching Straight Talk, and we'll see you next time.